Am I audible, visible to all of you? Yes. So there are only 6 questions related to psychiatry. Let us do a quick recall and discussion of the questions that were asked yesterday in INICET November 2023 exam. This time, 5 out of 6 questions were related to pharmacology. Yes. All right. So I've tried to recall the questions and I'll discuss them. So this was the first question that has been recalled. Any confusion, any doubt? A patient with Alzheimer disease doesn't want to take medicine orally. Which of the following acetylcholinesterase inhibitors can be used? What is your answer to this question? What is your answer to this question? Anyone here in the chat with me to interact? Alright, my answer is rivastigmine. Actually, if the patient is refusing the oral medicine, we will give a transdermal patch. Transdermal patch, not willing, doesn't want to take. And the transdermal patch is available for rivastigmine. This is mentioned in Maudsley clinical guidelines. Okay, have a look at this. Rivastigmine transdermal patch. Okay, actually nowadays we also have donepezil transdermal patch, but the studies for donepezil transdermal patch efficacy are very limited. Rivastigmine transdermal patch is available from many years. It does not require a cold temperature to be stored. Its effectiveness, studies, safety, tolerability is far better than donepezil transdermal patch. Although orally we prefer donepezil, but traditionally we have been using rivastigmine transdermal patches. No confusion in this question? Second question that has been recalled was a patient on mood stabilizer developed hyperammonia and raised hepatic transaminases. Now, raised hepatic transaminases can be caused by any hepatotoxic drug, including carbamazepine. But hyperammonemia is a very specific side effect of valproate. It is also mentioned in your psychopharmacology class notes. Were you able to answer this question? A specific lecture was taken on psychopharmacology where I pointed out that this is the most important side effect to remember about valproate, hyperammonemia. Were you able to answer this question? This was also in the INIPYT. This was also in the psychopharmacology class notes. Were you able to answer this question? I hope yes. Question number 3. It is a repeat question, PYQ. It was also there in the TND this year, test and discussion batch this year. All side effects were more with carbamazepine than oxcarbazepine, except answer is hyponatremia. Hyponatremia. Were you able to answer this one? I think it is pretty much clear then when oxcarb was invented. Oxcarb had lesser dermatological side effect, lesser rash, but more of hyponatremia. Were you able to answer this one? It is a PYQ discussed in the INICET PYT session as well, discussed in the PYQ kebab session as well. I hope you were able to answer this. Now the fourth question, a little controversial one. A pregnant female diagnosed case of bipolar with previous history of 4 episodes and no episode for the past 1 year. Well controlled on lithium. Now it is in the third trimester, came to psychiatrist. The key feature here is third trimester. In usual scenarios, we would check the serum lithium levels, and if the left levels are coming normal, we will not change the dose. But this is a specific question to asked in third trimester. I would like to show you the biggest guidelines that we follow in psychiatry, known as Maudsley clinical guidelines. And this is what it mentions. In the third trimester, an increasing dose of lithium is required to maintain the in the third trimester, an increasing dose of lithium is required to maintain the serum lithium levels during pregnancy as total body water increases. Even initially, I thought of decreasing the dose of lithium as a common thing in pregnancy, but in third trimester, they have specifically mentioned the use of lithium may be problematic because of changing pharmacokinetic. An increasing dose of lithium is required. You are right now seeing a screenshot, rather a PDF from the biggest ever, the most important textbook of psychiatry, known as Maudsley prescribing guidelines. I am quoting the reference from the most famous guidelines that we follow for psychiatric treatment. So since Maudsley guidelines has clearly mentioned total body water increasing, hence you need to increase the dose of lithium. Increase the dose of lithium. Convinced now? I think many of you mark decrease, but the correct answer is increase the dose of lithium. Now moving on to the fifth question. Now this question was about stages of motivation: pre-contemplation, contemplation, preparation, action, maintenance, and relapse. Let me tell you about these stages in case you have forgotten. I taught this in the DAMS lecture as well. Stages of motivation. These are the 6 stages of motivation: pre-contemplation, contemplation, preparation, action, maintenance, and relapse. In pre-contemplation stage, the patient has no intention to change the behavior. I am drinking, I was drinking, and I will be drinking. I don't think so drinking is a problem. I don't think so smoking is a problem. Contemplation is thinks yes, no. For pre-contemplation is no. Contemplation is yes, no stage. I may quit, I may not quit. What if I quit? What if I don't? If I quit, I can't enjoy my life. If I don't quit, my wife will leave me. Let her leave, I'll get a new one. Contemplation. Preparation is I will quit, but after a few days. Then action is I actually quit. Maintenance is I maintain for a few days, and then relapse. These are the stages of motivation by Prochaska and De Clementi. Let us have a look at the statements we have. When the patient is not sure, it is called contemplation. It's a true statement. When the patient is maintaining and has not smoked since then, it is maintenance. Pre-contemplation, the patient will think it is not a problem. Okay, but it is a problem. It is a problem. Action, no. So the correct answer for this is 1 and 3. Some students were saying A and B were there, whatever it is, but you understand the concept that pre-contemplation, zero motivation, I don't want to quit. Contemplation, I may quit. What will happen if I quit? Maintenance is remaining quitted. Action is actually quitting. Do you understand this question? Do all of you understand this question? Yes. Sixth and the last but not the least, patient on amitriptyline was found unconscious. So it is like a TCA overdose. TCA overdose is known to cause arrhythmias, known to cause confusion, but it causes a feverish state and it causes pupillary dilatation. So the better answer is hypothermia. Hypothermia is not seen in TCA overdose. TCA overdose has been asked previously in the exam and has been discussed as well. I would like you to have a look at the textbook TC overdose. Overdose include agitation, delirium, confusion, convulsion, hyperactive deep tendon reflexes, dysregulation of BP and temperature. Patient then progresses to coma and perhaps respiratory depression. So cardiac arrhythmia is seen, then fever is seen, delirium is seen, mydriasis is seen. Arrhythmia, confusion and pupillary dilatation are seen. Answer is hypothermia. So I hope this preliminary discussion was helpful. I would like to know in comments how many out of these 6 were you able to mark correct. And did you see the analysis? This is the first time I am seeing no question on disease, 5 questions on drugs, and 1 question on stages of motivation. May I know your score out of 6? Were you able to answer? Even if 4 out of 6, it is a decent score out of the 6 questions, because rivastigmine was not known by many students and even lithium question was confusing. But amitriptyline, contemplation, oxcarb were, doable questions. So 5 out of 6 were doable. Okay. I hope the session has been a little helpful for you. Please let me know in comments, chat. You can also connect me on WhatsApp, Telegram, Facebook, Instagram, and let me know whether this was helpful. Thank you very much. That's all.